The number of people using GLP-1 medication to lose weight has skyrocketed, this as national obesity numbers start to drop. But many are concerned about the alarming misuse of these drugs. NBC5's Kate Chappell in studio now to explain. Kate.
Allison, a recent Gallup poll finds 11% of adults now take GLP-1 medication for weight loss. It's a pretty big jump from the 3% just 2 years ago. Obesity rates are also trending down, and some experts link that directly to GLP-1 use. But with the drugs so widely available now, doctors do want people to better understand how to use them effectively.
I had a dream that I had passed away, and I kept thinking, my children, my sons are not going to be able to carry a casket.
Guadalupe Figueroa still gets emotional thinking about her life before bariatric surgery and GLP-1 medication, especially why she put on so much weight.
One of my sons was a homicide victim. I became what they call a closet eater, a midnight eater, and go into the refrigerator just to get comfort.
Obesity is a chronic disease defined by having a body mass index over 30. An equation using a person's height and weight to establish if they're healthy. It can be caused by genetics and hormones, as well as age and lifestyle. Edward Butler knew he needed help after a heart attack and subsequent congestive heart failure.
The doctors were saying that they don't know how I was still alive.
After years of putting it off, the former security guard had laparoscopic sleeve gastrectomy in May, a far less invasive procedure than bariatric surgeries of the past.
I was at 412, and currently now I'm at 344. And dropping.
Both Guadalupe and Edward turned to Dr. Rami Lutfi at the Chicago Institute of Advanced Surgery for help.
We do customized therapy for each patient, and Edward was sick, and medications would not have been the right choice for him in the long term.
Patients with a BMI over 35 qualify for surgery, even without comorbidities. And though millions have turned to GLP-1s for help losing weight, which are generally considered safe with moderate side effect risk, Dr. Lutfi cautions they're not right for everyone. He says age and weight are two of many factors considered, but GLP-1s are for long-term use and wouldn't be best for patients like Edward, who need to lose more than 20% of their body weight.
And once you stop, it's very unlikely to keep the weight off. But because GLP-1 are relatively recent, 10, 20, 30 years, post-marketing data just is not there.
However, it can be a complementary tool post-surgery, and was for Guadalupe.
We get older, our metabolism slows down, our movements slow down.
She had lap band surgery in her 50s and a revisional sleeve at 61. Now in her 70s, she's using a GLP-1 for additional support, keeping the weight off.
I'm more active now than I was in my 30s.
We should never think, is it surgery or medication? We should work together on multimodal therapy.
Stories like Guadalupe's and Edward's
kind of feel like Tony the Tiger. I'm great.
Illustrate the potentially transformative impact these treatments can have, combined with lifestyle changes and both doctor and familial support.
It's about the team, because as complex as obesity is, so is weight loss. You need support.
The cost of these drugs remains a major barrier, which is why a lot of people are turning to the internet to try and find cheaper options. But unexpected side effects have led to a major rise in calls to poison centers. So coming up in part 2, the red flags you should look for online. That's tomorrow night at 6, Allison.
Thanks so much, Kate.